Hi, it's Cindy here, and I want to address the topic of treatment scheduling with the PiezoWave to Vet Shockwave. This is a common question that we are asked, and I want to help you all understand that it is very dependent on your injury, your patient, and your patient's goals. In our small animal users guide, we made the recommendation of treating one time per week. We do believe you need a series of 3 to 6 treatments to get full tissue healing or as best tissue healing as we can get for the particular situation. Why did we make this suggestion? Mostly because the modality is so easy to be used as part of the rehab session. So it does not have to be used as a separate visit because of the ability to treat without significant pain or post-treatment pain. So treating once a week in your rehab patients is a very convenient way to keep them on schedule and to do great things within the program they're coming to your facility for. Now, that's not a must. That's a suggestion. And it's important to remember that tissue healing takes time. There's a great review about rehab post cruciate surgery and the time it takes for tissue healing. And we have to keep in mind that tendon that is damaged is going to take 3 to 6 months to heal. And it does need a few shockwave treatments, whether it's 3 treatments, whether it's 6 treatments. This will depend on the extent of the injury and the dosing that is being given with the shockwave. However, you are welcome to spread your treatments out as is convenient for the patient and the practitioner, as long as there are at least a series of treatments within the tissue healing phase. So if it's a tendon that has a significant damage and we know that animal is going to take 6 months to heal, you can easily treat every 4 weeks. And if they miss the timing because of vacation or some other issue in life, it's not going to be a game changer for the healing of the tendon. Just do your best to get a series of treatments in during the healing phase. And that is a really where the rubber meets the ground. You need to heal the tissue to the best of its ability and make the healing as biologic and physiologic as possible. And that's not always as fast as possible. Fast is not always the key, is getting a structure that is biologic, that is strong, and that is flexible. So when scheduling with the PiezoWave, my suggestion is I like to work on a weekly basis. It keeps me in a schedule. I work on a month. So I like to schedule 4 weekly appointments and then a doctor recheck. That is not absolutely necessary. You are a veterinary practitioner and you can make the decision as long as a series of treatments is completed within the tissue healing phase. So I hope this helps you guys, and feel free to reach out with more questions.